My name is Phyllis Lemcke. I live in Guelph and have been coming to Dr. Brent for 13 years. The most dramatic treatment was on my daughter Erin, who is now 23. And she, from the age of about 6 months old, had chronic ear infections. She started treatment, chiropractic treatment, when she was 10. And she's done treatments for a variety of other things, but the most dramatic was the ear infections. A lot of the things relieved the symptoms, but never fixed the problem. And I found that really frustrating because I would keep taking her and they would keep doing things that relieved the symptoms, which is basically what the tubes do. She still had the ear infections, but they weren't as painful, and there wasn't such a risk of her eardrum bursting. But it didn't cure the problem. We tried everything that we could possibly think of or find on the internet or somebody told us about, which is how ear candling came up, because I thought it was a pretty weird treatment at the time, but we were willing to try it because we were afraid that she was going to lose her hearing. I had never even thought of chiropractic treatment for her problem. I mean, thinking back, I don't know why I never thought of it. It just never occurred to me that chiropractic could fix ear infections that were that severe. I mean, well, you can imagine, like, you don't want to. Like, I didn't want my child on antibiotics for a whole year. Like, for a whole year. They thought if they got the infections under control, they wouldn't recur. Like, within weeks of them stopping, after a whole year, we were right back at square one. Right back at the beginning, you know. When she first started chiropractic treatment, I think she had watched me have treatments several times. So she wasn't apprehensive about it. I think she was at 10, a little cautious, because I don't think she knew exactly what to expect. But she wasn't afraid, and it didn't hurt her. Dr. Brent is very gentle with kids, and he talks to them and he tells them exactly what he's going to do so that they're not surprised by anything or scared that this is going to hurt. He assures them it's not going to hurt. He tells them exactly what he's going to do, and I think with children, probably with everybody, that's very important. And it's important to the chiropractic treatment because if the child is tense and scared, the treatment is not going to be as effective. All I can tell you is that it does work.